The federal government will ship 1 million doses of the coronavirus vaccine to 250 community health centers nationwide.
Dr. Maria Simbra explains how those centers will be selected and looks at the program's future.
COVID-19 vaccines will be going directly to community health centers.
Pittsburgh is a city of many neighborhoods, and the cultures are unique in each one of the neighborhoods. These community health centers understand the needs of the populations where they're situated. They're physically in the community, and they've become a community resource.
Centers close to vulnerable populations, such as the homeless and people with limited English skills, will get priority.
These community health centers have relationships with the people that live there, and that is the most critical piece, especially when we see all of this mistrust around the vaccine and with systems and institutions.
The federal government will send vials to 250 centers nationwide and eventually to 1,300. Rising to the challenges of the past year has prepared them for getting shots into arms.
Most of what we've done with testing, we can repurpose to roll out the vaccines to these communities.
But it will take some planning when people might not have transportation or a computer.
What is your availability? Can you make it to a site? Or do we have to figure out a way to bring these vaccines out into the community, maintaining, rigid cold chain management? And if so, what does that look like?
Transiency is a concern.
We may not see them again. We are very well aware that sometimes that second dose is not going to be possible.
Even with all the unique considerations, having vaccines in community health centers is welcome news.
Calls daily. Where do I access this? Where do I get it? And so it's been a challenge.
The federal government plans to ship 1 million doses to these centers starting next week. I'm Dr. Maria Simbra, KDKA News.